Do you think over time there's going to be, you take the picture of the patient and then the computer is going to be like, this is the best nose, this is what you should do?
Well, I do think that it may be headed in that direction.
I think where we're going to run into some problems.
Today, we've got something that's a little interesting. This is kind of the future of where medicine seems to be going. We see it in radiology reads. We see it, all different aspects of our lives. And that is artificial intelligence in aesthetics. It really started, I would say, I think this is a subject that's near and dear to my heart because I really enjoy blending art and science. And so this is something that can be extremely interesting, but where does it end? And so the real question is, we've started with virtual type of medicine, and that's where I think that has been in the form of the Vectra 3D imaging platform has been one of the biggest advances in, instructing, educating, and patients, and even booking cases, because I think long gone are the days where we just say, hey, trust me, everything's going to look good. And this is where perceptions have changed. And I think now to be able to visualize certain things, I use it for rhinoplasty, you use it for breast augmentation and breast work. We can use it for liposuction and all kinds of different things. But really the idea is using technology in medicine. So virtual, I'll get your take on it. But for me, I think it's, one of the things that has elevated our ability to educate a patient on what to expect.
Absolutely. And there's a lot of pros and cons for this. And that's what we're going to go over today on this podcast, how we can use artificial intelligence to benefit and to progress aesthetic plastic surgery and reconstructive plastic surgery. And in the dermatology world, I think it is going to have a place that's going to be unparalleled, because think about, it's very interesting. If you can take pictures of someone's whole body, do a full body scan, and then have them come back every year to make sure that their moles aren't changing. If you have a pre-existing history for melanoma or basal cell carcinoma or squamous cell carcinoma, this is incredible because, yes, we're all humans and we can miss things. So outside of aesthetic medicine, I think AI for radiology and for other things, it's going to have such an incredible impact that it's going to be it's impossible to miss certain skin cancers or certain diagnoses. But I do think for aesthetic medicine, I think that there are pros and cons. And I think that's what we should talk about today, because using AI could be amazing. But the one thing we always talk about here is we want to make you the best version of yourself. And that's the key.
Yeah, listen, I think we've been trying to do this for decades. When you put the top chess players up against a computer, and the idea is, who's going to ultimately prevail. We use AI, artificial intelligence in just about every aspect of life now. I mean, now we're looking at writers going on to an AI platform that will help them get beyond the writer's block and write for them. We've got AI in artistry, which ultimately there is a platform now where you can use it and it will create art for you. But I think the idea is, when you use the human mind, which again, we've got trillions of synapses that are happening. I think there's something to be said about the human mind and how we can circumnavigate our way around a particular problem. And so in aesthetics, so I get the concept. Let's say the one thing that I think that artificial intelligence in aesthetics will do is it will bring all of the I would say the inexperienced injectors, operators, whatever it is, up to a certain level, because they don't have to think.
Sure.
The computer just tells them the likely probability that this will lead to a good outcome is this.
I mean, yeah, so, think about what you're saying. Take a picture of my face animating and say, where should I put Botox?
Sure.
Simple. This is the simplest application of AI. But if it shows you points where you can get the best take or best results of Botox? Well, like you're right. Anyone who starts out, any nurse injector, anyone who doesn't have any experience, is immediately their experience is pulled up to a level platform in a sense, because they're teaching them exactly what to do.
Sure. I think, the interesting part, Leonardo da Vinci always, came up with the golden ratio, and that was the 1 to 1.6.18. And the idea was that there were certain aspects in architecture and essentially in aesthetics where the closer you are to that golden ratio, the more aesthetically pleasing you will be, or the more perfect an architectural building will be, just because, it meets that golden ratio. When it comes to the face, so I'm sure those of listeners out there have seen this particular app where they take, 1,000 male faces and they take 1,000 female faces and then they blend them all together using technology. And the idea is it comes out to be, almost an androgynous sort of look.
Kind of like the predicament we have with different types of filters. It's kind of the same thing, right?
Yes.
People that make filters, everyone looks the same. And you're saying, when you blend it all together, the AI is great, but we're not trying to make everyone blend in to be exactly the same. I can't necessarily look like you, and you can't necessarily look like your wife. It's just, you don't want it to be that way. Yep. Although it is, it's kind of taking that turn.
Yeah, listen, I think it's very interesting. One, I should preface it by saying that aesthetics has changed throughout centuries on what we thought was aesthetically pleasing, from the 1200s on, has changed. It used to be that being, full, obese, bigger, fuller faces was attractive because it meant that you were wealthier. It meant that you had the reserves and the food, and those who were skinny and waif-like were poor. And obviously that changed. And I know that, we went through the Kate Moss era where all of a sudden it was that, waif sort of look. And now we're coming back to curves. Essentially what I'm trying to say is that as time progresses, our view of aesthetics changes. And I don't know that necessarily the golden ratio meets up every single time. My thought process, if the golden ratio made sense on everyone, then we wouldn't have filters that give us the Bambi sort of look with the overly large eyes and the accentuated cant to the eye to make it look a little more exotic. That is not a typical golden ratio. I think the idea behind AI, it would be amazing if the computer program could say, all right, how can we improve someone's face to make them more symmetric? Now, that symmetry equals aesthetics in most situations. So the idea is, you take a picture of someone's face. Let's say we've got thousands of MRIs that show as you progressively age, what happens to the face, where volume could be placed, what needs to be tightened, things like that. But I think in the true artist, there is a vision of, accentuating certain features that don't necessarily fall under, an AI generated image.
Absolutely. And it's just like saying, if you see 5 different women and they are all ethnically, let's say, exactly the same, you're not going to have the same plan for each one of their noses if you're doing rhinoplasties on them. Interesting part is, and I think if you really break down AI, it can be used in a variety of ways. And we're going to, again, today's more about aesthetic medicine. We can get into how AI can teach residents on how to put nerves together. I mean, we can go over how AI can teach people medicine in a whole different way, but that's a whole different discussion, and we can talk about that later. But when you think about it as how we're going to use it, initially when someone comes in for preoperative evaluation, and what Dr. Layke just talked about, it's probably, in my opinion, that's when we can use it the best, because we're using artificial intelligence to show somebody what is possible and have them take a look at it and be like, I don't like that. Oh yeah, that's amazing. And in simple standards is, hey, someone's coming in for a breast augmentation. they don't know what size they want to be. And you can actually show them. That's amazing. That's something that was never there 15 years ago. Or their nose or their face, or showing how taking volumes from one area and putting it in a different area, what it can really lead to. And it really will change patient outcomes significantly. Now, you have to understand, a human is still doing it. So are there going to be certain drawbacks or limitations to get you that exact outcome? A little. I mean, we show through some of your splints, your nasal splints, that you're actually creating a nose that's almost exactly like you're telling someone. So it's pretty close to getting as close to the computer simulation as possible. The thing I think that's the downside is when people come in and they bring you a picture and they say, I want to look like this. And sometimes that's where I think using computer to help us really simulate, it can be, in a way, the downfall of the uniqueness of how an artist really performs, and how, as a plastic surgeon, each plastic surgeon is a little different because of the way that they look at someone. If it wasn't like that, then we'd be completely just unnecessary in this world, and computers would do everything, right?
Well, that's the funny part is it's easy, I guess, to create an AI generated image, but a human's doing the operation. And so at this point, I don't feel, until that happens, which, I'm sure it eventually will, but until that happens where a computer is, or, some robotic assisted device is actually performing the procedure, there are nuances to each of our techniques. And so
you could have the argument that in some fields of medicine, the computer may be better.
Sure.
You can make this argument and say, if I have let's say I have certain symptoms, I don't feel well, and it's very vague, and I've gone to 50 different doctors and no one can figure it out. It's very possible that you can just put in all your symptoms and a computer can tell you what's wrong with you a lot better than a human. It's a sad case in the sense that diagnosticians are going to be obsolete over time. And this also goes for radiologists. The radiologist, and the way AI works, just so you can understand, it's all built. Most of it is built on algorithms and information that's already been put into a database. So imagine whatever a human learns, that's all they know, right? So that's, you come to me and you have all these different symptoms. I go over it in my head of everything I've learned, and then I come up with a diagnosis. Well, it's exactly the same for a computer. Computer learns a bunch of stuff, and then it just can basically give you or diagnose you from what they have available. If the algorithm is a little off, well, it can be a little off. So there's a limitation. But for radiology, if you just put in all the images, millions and billions of images of pathology or pathologic things that happen in a CAT scan or an MRI or an X-ray, well, the computer can figure it out much better than any human can, because a human can miss it. Unfortunately, in a sense, just diagnostic radiologists may be obsolete over time because it's going to be cheaper, it's going to be faster, and unfortunately for the human race, it's going to be more accurate. And I don't think you can make an argument for that over time. What we do is a little different.
Yeah, I think, again, it's so funny because when I see patients for consultation, I'll say, listen, I always recommend you meet with multiple surgeons because A, you want to feel comfortable with your surgeon because you're going to be friends for a long time. But B, it's because you want to make that sure that my aesthetic matches yours. And so each one of us has our own aesthetic. I will tell you that around Beverly Hills, I can take a look at some noses and know exactly who did the operation because they do the same thing every single time. Not everybody, obviously, but there are certain surgeons that will do the same nose every single time. And so you can essentially know who did it. And some people like that. I would say sometimes it's a little, more of my aesthetic to match it to that particular face. Now, if I had a computer-generated image that said, look, this is, and you have to understand, when I'm doing a 3D simulation, I'm creating that simulation. So it's what looks good to me. And you could go to 10 different surgeons and they could create 10 different simulations. That's why sometimes people will come in with a simulation from someone else and say, hey, I like yours better. Or listen, I like this one better. Can we do something closer to that? It's because each one of us has a slightly different aesthetic.
Now, do you think over time there's going to be, you take the picture of the patient and then the computer is going to be like, this is the best nose. This is what you should do.
Well, I do think that it may be headed in that direction.
And that's where I think where we're going to run into some problems.
Yeah, I think, here's the thing. I think that especially in certain noses with very thick, there's so many different variables. Let's say you have really thick skin or it's a very large nose. You come in with a computer-generated image that looks like, Megan Fox. You can give me that picture all day long, but it's not happening. I mean, it's just...
You took it right out of my mouth.
It's not happening in anyone's hands just because there are so many different variables that we cannot change.
And that's what the computer doesn't quite understand yet.
Mm-hmm.
It will probably over time. But the limitations as to what... it's easy to plug in a bunch of stuff and then have it come out, but how somebody heals, the way the cartilage goes, how thick the skin is, all these things... Over time, I think they will be variables that are going to be put into AI, so AI can understand that. But I think, again, it's a little early for them to understand all of those things. So I think in aesthetic medicine, I think we still are the gatekeepers in a lot of ways, in the sense that I don't think AI can take over what we do. However, in some surgical fields even, you've got robots that do the operation or help with the operation. Can't really have that in our world, right? Because again, there's an artistry associated with what we do that a robot necessarily can't do yet. It may in the future, but it cannot do yet. So when we think about using AI, there's from the preoperative planning to then the diagnostics, then the actual treatment, and then there's the post-op care. And again, some of this artificial intelligence or computer learning can teach us things far beyond our experience, because it can take hundreds of thousands and millions of cases and put them together and say, hey, putting this bandage on there is not a good idea, or using this suture in here is not a good idea. Mm-hmm. Things that we anecdotally will talk to each other about, but there's not that much data. This can completely revolutionize outcomes that can be really, really beneficial for patients. So that's something I think where AI can be incredible. And we've been using this type of somewhat type of technology for a long time, but I don't think it's ever been this good.
Mm-hmm. Yeah, the one thing where, again, let's say I even took, a patient came in and I said, give me a photo of yourself from 20 years ago. And then we compare it to what they had now. And then you plug it into a machine and say, okay, what can I do to get closer to this? The difference is in that 20 years, you've already lost 20% of collagen. So it's, I can fill you up in the areas that the computer is telling me to, but it doesn't mean that you're going to react the same way. And who knows if the filler stays in that spot, if it migrates, there are all kinds of different things that can happen. I'm excited to see where some of this technology will go on one hand, because think of how easy it will be if you had a picture of someone animating and it said, all right, you need 42 units of Botox that need to go in this the area. You'd be done in a minute because you know exactly where to do it. You'd probably have less complications that may occur, dropping a lid or a brow, or, leaving some residual. The hope is that you would, reduce some of the minor complications that can occur. I just don't think that this will necessarily translate as we age, just because tissue quality is different. And so,
for each person too, that's the key. It's like, we're not all just robots. We're all so different, ethnically diverse. Everyone from different areas heals differently. Their skin kind of ages differently. There's so many factors. Mm-hmm. I mean, just simply think about hair loss. Forget about anything else. You can have men that are the exact same age, from different parts of the world, from different backgrounds. One can have male pattern baldness, one have thick hair, the other one could have random alopecia. And these are things that, again, they can't all be treated the same way. So that's where you run into problems. And again, the big obstacle with AI is this. Remember, again, it's the information that you put in, that's what they're analyzing. So if, for example, the artificial intelligence only has the golden rule for facial analysis, well, every single person's face is going to be analyzed based on that. Mm-hmm. So ultimately, everyone's going to try to make everyone look that perfect look. And I think to me, that's the problem where AI and aesthetic medicine, I don't think work very well, because the whole point is we don't want to make everyone look exactly the same. Even though that's been the new norm lately, everyone's kind of had the same type of surgeries, whether it's a BBL or a lateral brow or the fox eye, or we're not supposed to be all looking exactly the same. And some people need different things. So I think when you take like a picture of your face and you plug it into AI and say, what does this need? We'll probably say the same things as the next person to the next person, because they're all trying to reach the exact same goal. And I think to make it perfect, it should be really customized and specialized for each individual person somehow.
Yeah. And I think right now that's where the surgeon comes into play, or the provider, just because some people, you had mentioned the fox eye, some people look really good with that. Other people look strange. Exactly. And so the idea is you can perform the exact same operation. It just doesn't look quite right.
And that's where you get into some ethical issues too. You know what I mean? Somebody comes in and says, make me look like this. And you're like, well, I don't think that's going to look really good. And you're stuck between a rock and a hard place. Well, the computer said you should do this. And you say, well, I don't think it's a good idea. And there's so many, this is just the way, way, way beginning of all this. And that's why hopefully in 6 months or a year, we'll talk about it again. And there's new papers that are being published in all our journals regarding using AI in cosmetic medicine and in just plastic surgery in general. I do think it's the beginning, but it's very, very exciting in a lot of ways.
Yeah, this is just the tip of the iceberg here. I think as it would be interesting to see what happens. I think that right now, if we throw everybody's face in a database and you say, all right, let's make an aesthetically pleasing face, and they're trying to match it to yours. Yeah, that could be very strange. It would be interesting to see, let's say you submitted 20 photos on an annual, for the last 20 years, you've submitted an annual photo. And then it tells you, okay, this is how you get back to this particular area.
That's smart.
It would be interesting to see. I just think we're still a long ways off from that. So
see, that would be genius, actually, if you think about it. So think about if you start taking pictures of yourself in a Vectra type machine, let's say, starting when you're 18, and you continually do this, and the practitioner that you go to continually does this and evaluates it on a yearly basis and sees where you're aging or how you're aging, and then combats it with the tools that they have, whether it's lasers or fillers or injectables or surgery, to try to keep you looking as close to what you looked like as you age. And I think that way we are just crushing it. It would be amazing, because you're just keeping, and we know these are things that we know facial aging. We've done studies on it. We see how the fat pads on the face descend, and how we get jowls or we get nasolabial folds. We know all this stuff. It's just a matter of now, imagine if you could use a computer based on just your own face on how to combat it. I think that would be using computer technology to its maximum to keep yourself naturally looking very young.
Yeah. And I think, again, it's still that conundrum but the tissue changes. And so, even if we were able to volumize and get you right back to where you were 20 years ago, the tissue is going to respond differently. So I still think it's going to be an issue. What do you do for bone resorption?
So that's when you actually have AI mixed with regenerative medicine. So you find ways to use regenerative medicine in the aesthetic field. So, everyone talks about taking stem cells and injecting them into their joints because they're having joint pain, or injecting it into muscle or tendons when they're torn. Well, imagine if we find a way to use regenerative medicine and AI mixed, then we've got the holy grail. At least in aesthetics. We can't fix everything else.
Yeah. So, listen, I think I'm excited to see what is going to happen. There's a part of me that's a little scared.
Sure, absolutely.
Just because we tend to, use something for, something good for something that's not good. We tend to do that quite frequently as humans. And I think that the positives will be that we can bring the inexperienced injectors closer to where they need to be, although at the same time, it's kind of like, when you used to have to memorize everybody's phone number, and now,
Sure.
no one knows anyone's phone number.
That's why they say 10,000 hours.
Yep.
To become an expert in something, you need to do something for 10,000 hours, the same thing for 10,000 hours. And then you're truly an expert. Well, now if you've got the computer spitting everything out for you, you're not learning everything yourself. So I think the generation of physicians to come, they may be one of two things. They may be the smartest of all time because they're using computer technology and actually absorbing it, or they may be the laziest of all time, whereas they just are walking around with an iPad. I remember being a medical student, and you had you had little, what are they called? Those, I don't even remember what they were called.
Yes.
And you would go on there and you'd put different applications on it. I'm aging myself, but med school was 98. So, and you would put it in like the pharmacopoeia. Instead of carrying around a book, you just put in and it was great because it gave you all of the counterindications, or all the different interactions for medications. It was fantastic. Now the same thing's out there for diagnoses. You don't have to think anymore. You just throw in a bunch of symptoms, and they say, okay, this person's got lupus or whatever it is. So it does change the way I think doctors are going to be. I mean, I come from a couple of docs in the family, and I just remember my grandfather, when they made everything computers at Cedars, he's like, I'm done. I can't do this anymore. Everything for him was, he was a diagnostician. He put his hands on you. He listened to your belly. He listened to your heart. People don't do that anymore. And is it better or worse? I don't know. I really, really don't know. Because if you really think about it, obviously computers are much smarter than humans. They are. But there is a downside. And I'm a little worried that, all these people that we trained with, I mean, think about all the radiologists we know. Think about, are they going to be done? Are they going to be obsolete? Or are they going to double check the computer's work now? Or is it going to be vice versa? And I think this AI is going to be in so many ways, like you talked about. I mean, they're making art that's just as nice as any artist. They're doing, everything's being done that's just as good. It makes you worry that the human race is going to fail and be completely taken over by computers.
Yeah. Terminator all over again.
Exactly.